Hi everybody, it's Melissa Wilson, physician assistant for AIM at Melanoma. We're coming to you live again on Facebook to talk about this time staying healthy during your melanoma treatment. It was actually a topic that was suggested by one of our followers on the last video, and we were very intrigued and decided to do the topic for this one. First off, if you can hear me, hit the like button so that I can see your comments, because I absolutely would like to know that you guys are there. Leave me some questions as we go along. I have a little bit of an agenda. I picked some things I wanted to talk about dealing with nutrition, but also happy to answer questions as we go along. You can always find me at the AIM of Melanoma website and can ask questions there as well. So let's get started. First, I want to say I'm not a nutritionist. I'm a PA. So I'm not going to talk about, the special, specific diet things. We're going to talk about how does this help you in your melanoma treatment. That's the most important thing. It's a question that I've gotten asked over the 14 years that I've been practicing in our melanoma center. So, we're going to answer it as if we were taking care of you. The first thing that I want to talk about is that there are hundreds and hundreds of diets on the internet that people have posted, and actually preparing for this Facebook Live, I went and I looked to see kind of what was out there. Know that there really is no approved diet for treating your melanoma. There have been many diets throughout the ages that has shown, some benefit over a few people, or non-trialed, clinical trial, like standardized regimens. One such example is the Gerson diet. Basically what that is like a vegetarian diet where you do juicing. You have to consume like 1 ounce of raw fruit and vegetable juice every hour for 13 hours out of your waking day. But it comes along with coffee enemas, which is basically what it sounds like. That you have to do between 1 and 3 a day of those as well. When I actually first started being a PA in melanoma, there were a lot of people that did that diet. They got really, really sick. They had, fast heart rates, lots of dehydration, really didn't tolerate it very well at all. And to be perfectly honest, it really, didn't help them. So one thing to keep in mind is if there's a diet that is extremely restricted in terms of a specific food group, if there are diets that seem a little bit nutty, like doing a coffee enema, they're probably have not been tested in a clinical trial setting. So just keep that in mind. We're not going to talk about all of those specific things. If you have a specific question, please let me know, and we can try to answer it. So what we are going to talk about, though, are the things that we know can benefit you. I actually have a few family members who are nutritionists. We talk to them, I pick their brains, and then all the things that we talked about in research and practice. So one of the very simple, stupid things is water intake. People that I work with know that I talk excessively about water and how important it is to be well hydrated. Your body's 80% water. It needs appropriate levels of water to function just for regular everyday living. The really great thing about water in terms of your melanoma treatment is that it's actually going to solve some of the biggest problems that we get asked about for side effects. So there were clinical trials that actually showed that people that drank half a liter of water, that's like 2 8-ounce glasses of water, had an increase in their energy by like at least 30% for an hour. So that's 2 glasses of water to get 1 hour of potentially better, energy. If you drink your recommended, 10 glasses of water a day, that's at least 4 to 5 hours where you will have clinically proven benefit of energy. It creates saliva. It helps keep your mouth nice and moist. A lot of people complain of dry mouth during treatment, not only with chemotherapy, but especially with immunotherapy that we give, the checkpoint inhibitors, the oral agents, like BRAF. And it actually has been proven that drinking water will help increase your saliva. It helps flush waste from your body. It helps to prevent constipation. It'll regulate your body temperature. Believe it or not, sometimes when you have that low-grade fever, it can be corrected by just drinking more. So when patients are dehydrated, their basal or core body temperature actually goes up by a few degrees. So drinking water can help with that as well. It protects your joints and muscles like a cushion. So, patients that are on PD-1 especially have complained a lot about joint and muscle pain. Hydrate your joints and muscles because that can very well be a very correctable cause of those symptoms. It'll also decrease headaches. About 80% of headaches reported that are not migraine in nature are from dehydration. So as stupid as it sounds, drink water. That's one of the best things that you can do for yourself just as a human. It's recommended that men get about 3 liters of water a day. Women get about 2 liters of water. It's really not that much. It sounds probably like a lot. For my dad, when he was going through treatment, I had to line up bottles on his countertop and say, like, listen, you need to drink all of these by the end of the day. And I was a pain in his butt in the beginning, but once he did that, he really did start to feel better overall. So that's one thing that is quite simple, doesn't involve medicine or buying things, and it can help. The second thing we get asked a lot about is exercise. Exercise is a good thing. You should continue to do it. Now, if you were not somebody who was exercising before you came and started treatment, don't start doing, some crazy exercise regimen. You want to do things that your body can listen to. You need to listen, like, is this too hard? Maybe I shouldn't be doing this. Walking, even just light walking, not even at a, Olympic pace, is good for you. It's good for your brain. It's good to relieve anxiety. It's definitely good for cardiovascular health and generalized well-being. But interestingly, and one of the most common complaints of immunotherapy is fatigue. It's also a really difficult one to treat. Patients that exercised, there was a trial that came out earlier this year that showed that people that exercised 4 to 5 times a week for 30 days during immunotherapy actually had about 50% less fatigue overall. They didn't do anything heavy. Most of them walked. Some of them did yoga. Some of them did continue to run, but when I read further into the trial, it looked like they were running before they started. So again, any activity that you can tolerate, especially if it's just walking, it's wonderfully beautiful in most places right now. Get out and walk. They also found that 30 minutes a day of exercise did not have to all happen at once. It could happen in 5 to 10 minute intervals all day. One of the things you don't want to do is stop your normal routines. From a medical standpoint, it's obviously better to maintain activity, but too from a mental standpoint, if all of a sudden you have this new diagnosis of melanoma, you have this new treatment in place, stopping things that previously gave you pleasure, like exercising. I personally don't find pleasure in exercising, but some people do. You will feel better. It relieves anxiety. It helps you clear your mind. It gives you something to focus on other than treatment. So exercise, both from a physical and mental standpoint, wonderful. We're happy with that. That's a good thing. Supplements. Here's the thing about supplements. You can get most of the nutrition that you need from a balanced diet. I know sometimes it's difficult to eat during treatment. I know that it's very hard to think about sitting down and eating 3 meals a day. Supplements, we get like turmeric, cinnamon. There are people that are taking, St. John's wort and all kinds of things. What we basically tell our patients, and what I have found from the research, is that because you can get most of the things through eating whole foods, it's much better and much safer to eat your supplements. So, put cinnamon on toast, eat it in your ice cream, have it, on apples. Cinnamon capsules don't seem to be a problem. In fact, there are a lot of anti-inflammatory processes properties to cinnamon, turmeric. People do that, and those kinds of things are generally safe. Spices generally tend to be very safe. There isn't enough data to know supplements and their effects on PD-1 and their effects on BRAF and their effects on the other immunotherapies that we're trialing. And so Generally speaking, there is not a supplement that's proven to prevent melanoma or to treat or improve the outcomes of melanoma treatments, not even antioxidants at this point. So until there is something that proves it, it's okay to eat those things. Always check with your healthcare provider to know whether or not they know of any specific interactions, especially if you're on a clinical trial. We always ask our patients to just ask before. So supplements, nothing proven, not entirely ever a bad thing. I'm a very big proponent in using alternative and additive therapies to help our immunotherapies work better. Right now there isn't any specific thing, but that doesn't mean that you shouldn't try it. If you can't eat or you're having difficulty eating, some tips that we tend to like to share with people is eat small meals. Don't try to sit down, eat breakfast, lunch, and dinner. Don't try to eat it on a big dinner plate this big. Start with smaller portions, tiny plates. Eat 6 to 8 times a day. I tell patients, be a grazer. You'd be surprised how many calories you can put in your body when you don't sit down and actually eat a formal meal. Sit them out on the countertop, have snacks all day long. Also drink high calorie drinks. That doesn't mean ensure those sometimes can be tough to palate. Things like juices, milkshakes, hot chocolate, nectars, things that have a really high calorie intake that we probably don't want our children to drink, but are really good whenever you're having a hard time getting calories in or you don't feel like you can eat. And also eat what you like. I probably tell this story ad nauseum at work, but there was a man who, when he was getting ippy, was really not able to palate anything. Everything tasted bad or metallic to him, but he liked hot sausage sandwiches, and so the poor man lived on hot sausage sandwiches for 5 weeks. But by gosh darn it, he kept his weight up and he did well. So, all of these things that we talk about don't necessarily have to mean that you have to eat healthy all the time. Sometimes you're going to eat ice cream for a couple days, and that's okay. So just make sure that you talk to your health care team if they have any other additional suggestions, but don't try to force yourself to eat 3 meals a day. It's much, much easier to snack, just so that you know. So here's the thing that I really wanted to focus talking about. Hopefully everybody is still with me out there, is gut bacteria. So this is kind of a hot topic. Every time that I looked and tried to do research on the internet or with journal articles, this kept kind of coming up in terms of the future of diet in relationship to treatment across all cancers. What has been happening is for years, and I'm talking like the 1980s, they've been talking about the link between your gut bacteria and the immune system. And they've been doing this across things like seizures, autism, and now they're finally starting to focus on it in a cancer setting. In like 1992, they linked some gut bacteria specifically to patients who did better on the PD-1 agents. Same thing with CTLA-4. So this has been actually sort of happening in the background for years and years. They found out like 70% of your immune system lives in your gut. There are big melanoma centers right now that are actually investigating the role of gut bacteria in melanoma. What we know is that gut bacteria will help activate the T cells, and T cells are the things that you need to fight your cancer. So we know that, people that have the good bacteria in their gut respond better to immunotherapy. People that have the bad bacteria or things that they have decided after, modeling it in labs with mice, the people that have the bad bacteria are less likely to respond. But when they gave the good bacteria to the mice, and now this is happening and trialing in patients as well, people are responding to immunotherapy. So this is actually really, really exciting in terms of, things that you can do to naturally help you do better in immunotherapy. So this is really the meat and potatoes of what we all want to know. One of the things that they found is that people that had good gut bacteria actually eat a lot of fiber. So most people get about 15 grams of fiber a day. To like visualize how much that is, that's like 3 cartons of blueberries. I can't even eat 1 carton of blueberries, so 3 cartons of blueberries to get like the very low end of fiber intake a day is a lot. People that generally, or mice that generally tended to do well, had a much higher intake, almost double that. So patients that did well on immunotherapy tended to eat about 20 grams or more of fiber a day. And people that did great, that had really amazing, almost complete responses to treatment, ate about like 30 grams of fiber a day. Fiber would be, vegetables and fruits with skins, whole grains, wheat, potatoes with skin. All of those things have really high fiber intakes, more so those natural things than things like a Fiber One bar or, a fiber supplement that you would drink. It's more natural things like natural derived fruits and vegetables. This actually also sort of links back to that Gerson diet, because people that actually believed, and where the research came for that was, a vegetarian high fruit and vegetable diet. Well, in reality, it kind of, parts of it are very, very true. So, eating lots of fruits and vegetables, making sure you put probiotics and prebiotics into your diet. What are those things? Bananas, asparagus, artichokes, sauerkraut, Greek yogurt. Those are all things that have active live bacteria in it that tend to help improve your natural gut bacteria. It also goes back to water. You keep your mouth hydrated, bacteria live in there. That's important. When you get dehydrated, those bacteria die. So people that drank more water, in the research that kind of has been brought out there, also did much better because it improved their gut bacteria overall. One small study that hasn't had a lot of additional data is they actually found that people that take probiotic supplements didn't have that same kind of response. So you can attain that same probiotic environment by actually eating real foods. So this kind of goes back to like the things that we recommend on a daily basis about what to eat. Lots of fruits and vegetables, lots of lean meat. It wasn't to say that people that responded to treatment didn't have steak every once in a while. Steak or red meat tends to cause inflammation in the gut, which they know does affect the bacteria and does affect your immune system overall. But it doesn't mean you can never have a steak. But really your meats, if you are going to eat meat, generally in normal health, should be from chicken and fish and things that are more healthy. Both fresh and frozen fruits are okay. Fruits and vegetables are okay. They're actually very similar in nutritional content. The most important part of eating the fruits and vegetables is actually to eat the skin. So don't be afraid to not peel your potatoes and make mashed potatoes. It actually is better for you from a fiber standpoint, and all the nutrients are contained in the skins of vegetables and fruits. The real big bad culprit are processed foods. And so when people are asking about diets and what things should I avoid and what things should I eat, eat the things you like. Try to have fruits and vegetables. Try to eat lean cuts of meat, but really try to avoid processed foods. Processed foods are so high in salt, they're really high in chemicals, to preserve them so that they stay fresh, so that they don't degrade, so that muffin that you buy after it's been to a warehouse and then to the grocery store and then to your house doesn't mold. High processed foods really do cause a lot of inflammation in the body. They create quite a bit of, irritation, not only in the upper, but also the lower GI tract where you're trying to house your immune system. It can lead to sluggish feelings, like that feeling when you eat, birthday cake. That's bought from a store, or you eat high amounts of sugar, you go have a big meal of pizza. That kind of sluggish feeling is one from blood sugar, but also your body doesn't like all of that extra chemical that it doesn't know what to do with. So, avoiding highly processed things, not only from a melanoma standpoint, but from a general health standpoint will really, really help. So when I talk to the nutritionists that not only work with us, but that are a part of my family, they said that's the number one thing that they tell their patients right off the bat is start to eliminate processed things. So that's really all that I wanted to try to cover today. I can't see the comments on here for some reason, which is no fun. I wanted to try to be able to answer some questions for you. So, let me know if you have questions. There are definitely multiple ways to get a hold of me. We can talk on Facebook. We can talk on the Aim at Melanoma website has both an email and a 1-800 number or 1-877 number where you can ask personal questions, more specific things. Probably are good to talk about off the air anyway. I really would like to be able to continue to do these Facebook Lives for you. Definitely would like to see more of topics that we would like to talk about. I think our next one may be about BRAF and everything you want to know about BRAF. So look for that if we do that in like the third week of July. And hopefully we can continue to find topics that everyone wants to watch. Okay? Have a nice night.